welcome. You're watching Beat Diabetes, Facts, Myths. I'm Sonal Mehrotra Kapoor. Now, the COVID-19 pandemic has had positive, some negative impacts on different aspects of all our lives. It really touched each and every individual on the planet. The negative side and the lifestyle behaviors associated with them have been the ones that have been most talked about, led to several adverse outcomes as well. So while dealing with COVID, we overlooked, and especially during the lockdown, we overlooked the fact that people's lifestyles were severely disrupted. Many people have become physically inactive, developed irregular eating patterns as well, which led to several unhealthy lifestyle disorders as well, and for several people aggravated some lifestyle-related diseases. COVID-19 pandemic has also caused significant changes in our homes, in our life, in our stress levels as well. A multi-sectoral approach then is the need of the hour, something that promotes healthier diets, increased physical activity, and all of us to help and slow down what is being looked at two major outcomes of this pandemic: a diabetic epidemic and one that is leading to several heart diseases as well. So how do we take control of both our heart and diabetes? This is Beat Diabetes, Myths and Facts, and we will be taking all those questions on how to actually reverse this with our experts. Joining us today on the program, we've got Dr. Kandula Rai. He's MBBS, DRC Director at GSL Medical College, Senior Consultant and Practicing Diabetologist over there. Thanks so much for your time, Dr. Rai, and welcome to NDTV. We also have with us Dr. K Mundhra. He's MD Medicine, Consultant Physician at Saroj Super Speciality Hospital in the National Capital. Dr. Mundhra, thank you and welcome to the channel as well. Also with us today is Dr. Rajendra Chowda. He's MD Medicine, Consultant Physician, EP Diabetes and Cardiac Care Center at Sagar. Hello to all of you. And let's just dive in straight with all the questions that we've got for our panel today. Let me take the first question to Dr. Rai. Now, Dr. Rai, diabetes is now being seen as a long-term complication amongst people who recovered from COVID-19 infection. Now, we all know what steroids did to our bodies, some imbalance of it as well. But if you could point out what are the reasons for this new onset of people who have recovered from COVID-19 now dealing with diabetes?
There are 3-4 points regarding the new onset of the diabetes. One is genetic factor. Those people who are prone to get diabetes in later stage, this disease may propagate and make that it happens earlier than what it should be. Second is the anti-direct inflammatory effect on the pancreas, where insulin is being produced. So third is stress induced, stress due to either disease itself or due to the drugs, as you mentioned, steroids and so on and so forth. And there is a transient insulin resistance where the insulin what is being produced in the body may not work at its stage. Though due to the cytokines means the anti-inflammatory process responds to the COVID which entered into the body. In normal stages, cytokines are being released for certain extent to combat the fight against the infection. What happened in the COVID is we called it cytokine storm. Too many cytokines were being released into the body, which may damage pancreas directly. And third and most important thing is when the COVID virus entered to the body, it attached to the ACE inhibitors receptors. So that is the port of entry into the body.
All right, thanks so much for that information, Dr. Rai. Let me take the next question to Dr. Mundhra here now. Now, what additional care, doctor, do you think, or precautions really one should be taken by elderly people with diabetes who have also recovered from COVID successfully to really avoid any long-term impact, whatever little we know of long-term impact of COVID really as of this moment?
Yeah, these long-term effects are multiple, and these patients who have recovered from COVID, most of them did get steroids as well. And now they are homebound. They are not doing their regular exercises. So they have to start maybe inside their house only, spot jogging, spot walking, and they have to mind their diet, eating habits, because they are homebound, they are working from home, or they are not taking enough calories. Some of them are having multiple other issues. So they have to manage their diet, they have to manage their exercise, maybe 15 minutes in the morning and 15 minutes in the evening. And they have to go for regular blood sugar testing as well. As you know, if you do not test, you do not know till the blood sugars are very high and they can lead to further complications. So they have to monitor their blood sugars regularly. They have to monitor their diet and exercise. They have to manage their lifestyle, and if required they must start medication early so that they can prevent future long-term diabetes related complications. There is no harm in starting medication. They can be withdrawn at a later stage if the blood sugars are very well controlled. We have seen in many patients they require blood sugar medications for few months and then gradually you can taper them off. So these are the things they must do regularly, and they should be in touch with their treating physicians so that they can always guide them regarding all this.
All right, some good tips there on regular monitoring that is going to be the real key there for several of the people. Well, let's take it forward now and bring in Dr. Rajendra in the conversation now. Now, Doctor, we all know that COVID-19 can worsen the condition of the heart patients as well, right? Can COVID-19 infection actually cause more heart failures in healthy people as well? I mean, we are talking at a time when India is reporting so many young people dying of sudden cardiac arrest and heart attacks. So one really wonders if there is a relation between the two at all.
Yes, of course. Healthy person can get heart failure in COVID infection and post-COVID sequelae, because in corona patients, even after recovery, there's an increased coagulation inside the body, and increased coagulation inside the body leads to more chances of development of coronary artery disease, leading to unstable angina and acute myocardial infarction. There can be some possibility of direct damage to the heart muscles, leading that is known as myocarditis. And these myocarditis and heart attacks, coronary events, both together can cause heart failure even in healthy patients. Of course, if the patient is already having any evidence of coronary artery disease, those patients, they are more vulnerable. But the normal person, normal healthy person can develop cardiac episodes because of the myocarditis, because of the direct damage to the muscles, and because of the coronary artery disease.
Let me take the next question to Dr. Sai then. People who have been recently diagnosed with diabetes or even pre-diabetics, Dr. Sai, hope to stop medications in the future by making suitable lifestyle disorders, right? Now, the key question here is people often wonder if diabetes is reversible, or this is just something that you have to live with and keep popping pills all your life.
Yeah, there are two entities in this. One is remission, as you told, and another is reversible. Remission is the temporary phenomenon, whereas reversible is a little longer term phenomenon. But you should know a simple fact that DM is a lifelong disorder. Nobody can take it out. And the only thing is, as Sir told, with lifestyle modifications and diet control, you can remission and reverse also can be possible for certain extent. Surprisingly, what happens is when the patient is on drugs, that is metformin, in the early stages of diabetes, their response to that drug for control or remission is only 31%. Whereas if they follow lifestyle modifications strictly and very seriously, the remission percentage is 58%, surprising. So lifestyle modification working more better than the drug if you are strictly follow to that. Other thing is, if you happens to have that remission or reversible disease, you should not, as Sir told, you should not forget that you're a diabetic lifelong. So periodic checkups once in 2 months, as per that. Don't leave the doctor, for God's sake. And go to the doctor once in 2 months, 3 months, get the HbA1c. That is the last 3 months average the sugars, which everybody knows that. Recently, people are fond of about bariatric surgery. there is some indications are that each and everybody cannot go and get the surgery done. There also there is a reversible diabetes is happen. The only procedure or by that the only thing you can get the reversible of the diabetes for certain extent or some extent.
Dr. Mundhra, due to work from home, the routine of many people has been disrupted as well. They're not getting adequate sleep, patterns have changed. Can this lead to also heart disease? How many people actually say to you some stuff like this that comes to you? And how many hours should one be getting? How many hours of sleep should one be getting daily? You know, it tosses between 6 hours to 8 hours. And people who get less sleep at night, is it okay to compensate for that during the day?
The people are homebound and locked down, or because of the COVID pandemic, they are at their homes and they are not following their regular routine exercise. They are gaining weight, too much of snacking, too much of eating. So weight gain is there, lack of exercise, lot of stress levels. All of them are really causing lot of blood sugar changes. These are the patients which may get complications of high blood sugar, high blood pressure. And the sleep, as you said, sleep pattern 6 to 9 hours are good enough. It varies from person to person. But it has been seen, if you are deprived of sleep for a longer time, your blood pressures are high during night time, your heartbeats are high, your oxygen saturation may vary. This we have studied with sleep study during night time. And the patients with chronic obstructive lung disease, they are having a lot of problems. People who are having a lot of snoring, obesity people, they're having a lot of high blood pressures and all during night. And they have more complications of heart disease, hypertension. And it has been seen, it's more often than not in such people who are having lack of sleep. Of course, catching up with the sleep during daytime, half an hour power nap also can be helpful in some of them.
Right. So sleep, very important. And also the quality of sleep. That's something even more that needs to be talked about. But we'll dive into that. Let's slip into a short break. We'll be right back. Welcome back. You're watching Beat Diabetes, Facts and Myths, and we are joined by experts as always to answer all your questions. Let me go to Dr. Rajendra next. Dr. Rajendra, there are various medications available for the treatment of diabetes as well. Some people need oral medications, others need insulin. Now, can a person on oral take insulin? Can a person on insulin after long term of control on blood sugar actually switch to oral medication? What exactly is the science there?
There are a variety of medications which are available to treat diabetic patients, like insulin, which leads to increased production, insulin sensitizers, incretin-based therapy, SGLT2 inhibitors, a carbose group, and of course insulins. The person who are on oral medication should be ideally shifted to insulin therapy in all type of medical emergencies, like during surgery, during heart attacks, during paralysis, or during when there's a damage in the kidney, or during pregnancy. In the same way, any person who is taking insulin regularly, but there's a normal blood sugar for a long time, normal HbA1c, and there's a minimal involvement of the target organs, then these type of patient can be switched over to oral medications.
All right, next question for Dr. Sai. Dr. Sai, hypoglycemia is common in people who take insulin injections, right? What could be the reasons for that, and is that preventable?
A good question. The diabetic patients have to know that consequence of the high blood sugars. More than that, they should know the consequences and symptoms and treatment of the low sugar. So if the patient's sugars are high, today or tomorrow, day after tomorrow, we can treat it. But where the sugars are low sugars in the theoretically means less than 70 milligrams of the milk deciliter. So normally it should be 100 to 120 in the fasting state. And if it goes below the 70, lot of the things will happen in the body, from brain to heart, everywhere. So there is as you asked, the common situations where people who are taking insulin are getting low sugar is, one is technique of the insulin. Nobody know, most of the people don't know how to take insulin. Second thing is, the patient is having blood sugars around 90 and 80, very good control. If he gets the sugars down 70, he may not be knowing. But after some time, some symptoms will occur: excess hunger, sweating, palpitation, tremors, confusion, blurring of vision, headache. All these things may come. We have to explain the symptoms of the hypoglycemia first to the patient and ask him to repeat the what we told to him. Commonest cause of the hypoglycemia is the not following the right advice. Right advice means what to take, how much to take, when to take. Gap between each breakfast and lunch, or lunch to dinner, or dinner to morning breakfast. Because, doctors will tell you when to take, how much to take, how many major meals, how many minor meals.
All right, thanks for that answer. Let me go to Dr. Mundhra next. Dr. Mundhra, diabetes affects body functions, right? It affects a majority of important body parts as well. Could you explain to us what microvascular complications can occur due to diabetes?
Diabetes, as you rightly said, can affect many organs of the body. There are two types of major complications. One is macrovascular complications involving the heart and the brain, the bigger arteries of the blood, body organs, macrovascular complications. And the other is microvascular complications affecting the smaller arteries of the body. So there are three types of microvascular complications involving the kidneys, involving the eyes, and involving the nerves. Whenever there is microvascular complication involving the nerves, we say it is neuropathy. The patient feels numbness, tingling, burning sensation on the feet. Sometimes the sleeper goes out and patient does not know, is not aware. So he develops diabetic foot ulcers. Sometimes amputation has to be done. Then the retinopathy. Involving the eyes, the patient may have blurred vision, total loss of vision, bleeding inside the eyes, swelling inside the eyes, lot of clotting inside the eyes, and then nephropathy. Nephropathy is involving the kidneys. What happens? The filter of the kidneys gets damaged. So they start losing protein in the urine, which is a dangerous complications. Normally the protein losing is around less than 30 per 24 hours, but they start lots of protein losing in the kidneys. And second, the kidney function also goes down. Their creatinine goes on increasing. So you have to decide the drugs also accordingly. So these are the three microvascular complications involving the eyes, the nerves, and the kidneys. And the macrovascular complications, as I told you, involve the heart and the brain in the form of heart attacks, heart failure, brain attacks, strokes and all, and peripheral arterial disease. The arteries of the legs are also getting affected.
All right, I think we have time for one more question. Let me take that to Dr. Rajendra. Dr. Rajendra, many years of scientific studies have shown a close relationship between cardiovascular diseases and also your cholesterol levels. But how to deal with it really is the question. Should one be focusing on lowering dietary cholesterol or putting down saturated fat?
There's a very strong correlation of high cholesterol and a person who are taking saturated fats, leading to atherosclerosis process inside the body. So the saturated fat should be ideally less than 7% of the normal caloric requirement. One should not take a total fat-free diet. It should be a fat-restricted diet because about 15 to 20% of the calorie it should be obtained from the fat. And in various preparations of oil preparations, they are available in which contains polyunsaturated fatty acids. They are essential fatty acids like N3 and N6. They should be taken, and saturated fat should be restricted in normal diet.
All right, that's all the time we have on the show. Thank you all for joining us. Dr. Sai, Dr. Mundhra, Dr. Rajendra, thank you so much for your time. Let's all try and beat diabetes one day at a time. Thanks so much.